We have a catchment area of around 500,000 patients in North West London. And that means for us in radiology that we're doing around 350,000 examinations a year. The technology surrounding radiography has increased very rapidly, and particularly around detectors, so we had no hesitation in wanting to move to digital radiography.
Caroline Young?
Hi.
With the old system, I would get the patient into the room, I would have a cassette, I would take the x-ray, and I'd have to leave the room to go out to process the x-ray, which could take about 2 or 3 minutes. The Samsung machine allows me to take the x-ray, view the image within 3 seconds, and then move on to taking more x-rays. We are easily allowed to double our productivity now. The Samsung machine is very good. It's radiographer friendly, a lot easier to use, it's very light, and because we have the access of the remote controls, we can position a tube in the room before we've even got the patient in. The soft handling function is a lot easier to use because we can just move the tube along with 2 fingers.
The main problem with manual setups is that it's very physically challenging, and towards the end of a radiographer's career, they often suffer difficulties with back injuries.
The Samsung XGO is better than what I've used previously, simply because it's got really good dynamic range, really good bony detail as well as soft tissue details. Well, the accuracy obviously is vital to what I do. Having to provide a report and a diagnosis to a patient is key. The Smart Stitch function on Samsung XGO is really useful. Previously, we'd have multiple images which were separate, then you'd have to interpret them, allowing for overlap, so the accuracy would be down. On the Samsung XGO, it's just one image, which then allows us for better accuracy in our diagnosis.
The Samsung machine allows us to adjust the contrast quite easily, so there is less chance of us having to repeat the x-rays.
There's less radiation given to the patient. The post-processing software is efficient, so it means I can stay inside the room with the patient the whole time. I don't have to disappear somewhere else to process them. So as a kind of a rounded whole experience, it's a lot better for me and for the patient.
One of the main differences with moving to digital radiography is that the time involved around booking in a patient and taking an x-ray and then checking the x-ray on the conventional system is much shorter. We've found that the move to digital radiography has been accepted very well by both our staff and also the patients. Having chosen Samsung as our supplier, it means that we're the first European centre to actually work with this machine. And they've been particularly helpful in helping our radiographers learn how to move towards automated working. So moving to the automated processes has been a really exciting opportunity for us, and we've had a lot of support to do that.